Okay, right this way, Regina. Yeah, here we go. Oh my God, have a sit. You okay? You okay?
It was rough.
Oh yeah. Oh my God. Yeah, I understand.
Bad.
Wow,
I understand.
terrible.
Oh my God, you scared? Don't
Yeah,
worry,
a
we
little
here.
bit.
We help you.
Okay.
Can you get some water, please?
Yeah, I'll get you some water
Yeah.
here.
Okay, get some water.
Yes. So tell me how they look like.
Scary
Scary?
dudes. Big dudes.
Big dudes?
Yeah. Huge. Hey.
David, it's water for Regina.
Oh,
Get some another water. So there was there was a lady with them?
It was a lady too.
Lady with them?
Yes, it was two guys.
You
two
see, I
big
told you
guys.
this is the Fibro Felicia, that Marco, migraine, and headache headache Hank.
Hammerhead Hank?
Slaver, yeah.
oh man.
That's the
So
one.
you know about them.
We know. They always in Beverly Hills. We try to catch them. But
The
don't worry.
losers.
Are they take everything? Are they take your
Everything.
money? Everything?
Everything.
How do you feel
my
right
money,
now?
My time, my sanity, all of it.
Oh my God. I don't know.
Well, I can put this over here for you.
Leave the bag alone.
Oh,
Leave the bag alone.
Now he's going to take my bag too.
Yeah, I know. You
Everybody's
see,
taking my bag.
yeah. Don't worry. It's lady from Beverly Hills, so we need to be, So tell us more about this thing. How that happened? When this happened?
Oh, it happens frequently. I
Frequently?
see these three a lot.
Oh my God! Tell me more
They're
about this.
regulars.
They're regulars.
They're regulars.
Yeah. So tell me, what's the first symptoms when? Who's coming first? Is that migraine? Is that the headache, or is that like you wake up being tired, which is fibromyalgia?
I think fibromyalgia is the gang leader, honestly.
Yeah, she's the one. She's sometimes the migraines and headache, and they bring the fibromyalgia, but sometimes fibromyalgia bring those two guys on the board. So they really
They are
serious
gang.
stuff.
Yeah, and they've got it coordinated, so they come on together.
Yeah,
Well orchestrated.
yeah. We've been trying to fight them many
bullies,
years.
bullies.
Bullies, yeah.
Totally bullied.
So tell me, what's your first what's the first thing? Are you feel tired? Or you feel like maybe some lights aggravate you? Maybe some noises aggravate you?
It's always exhaustion in the beginning.
Exhaustion, and you wake up already exhausted?
I can wake up exhausted, or it can be a time when I shouldn't really be tired, but I can't stop yawning, and I just can't stop feeling sluggish and brain fog.
Brain fog, yes.
Wow.
It's a lot of brain fog.
Brain fog, I know.
Okay, yeah. So this is looks like it's our case, and we try to help you. We try to catch those guys.
Yeah.
It's at least to do something about it, to make sure they're not gonna go around you so often.
That would be nice.
Because it's in the combination of exercise, medication, and it's other stuff. Let me sharing my experience with those gangs, with this
He knows.
fibromyalgia. A long time ago, when I start my career in this postural department, the one lady shows up and she's described like you did. Everything, pain everywhere, clavicle, sacrum, headaches, and as a young massage postural detective therapist, I'm just as usual work the whole body, and I thought it's fine. Maybe just person sore, maybe she just been work out. But after I call my master and I ask him about this symptoms, and he said, could be that one of those fibromyalgia, Fibro Felicia. So I started learning about this, and very, very interesting. During that study of fibromyalgia and migraines and headache, so many people start come to me.
Yeah.
And
Oh, yeah.
what I did, I always ask him, what's to truly help you? Like, what do your own remedy? And you know what? As you're sharing this with me, your diet is very effective.
Very.
So when Regina do the dairy, it's comes up right away. But we all love dairy. You can't blame. You love the cheese and
I know.
and beer and
I got
beer is I know.
I got my
That's
own
my favorite.
cow.
Yeah. Oh, here we go.
Oh,
You milking in cow, huh?
I got my own.
You got
got
your
your
milk
own.
cow.
Oh, yeah.
Wow.
I'm in business here.
You see? Yeah. So I remember. Yeah, I milked cow once. So the truly the diet is very important for us to watch it. Also, I have one lady. She's like that cold therapy. So she always go to those plunging ice bath. Another person, and most, yeah, it's help to her. Like I said, all different. One person actually do some electric stimulation. So she put this electric stuff on her, and it stimulate her, maybe work with the fascia, with the connection neuron, and it's help. It's not constantly gonna take away, but it's definitely help.
Does she glow in the dark after?
She go in the dark after? I don't think so. No, I didn't. I move out. I'm sorry. I didn't know what's happened after her. She might be watching this now and maybe say hi and say how you feel now. But definitely, what's truly not help people, I see they go to the doctors. I understand medicine is important, but to give people 6 all different prescriptions and therapy,
Makes it worse.
exactly.
For me.
For you too. You see, yeah, I have this in the past. The one lady, she took 6 all different medication, and what happened, she started gaining weight. Weight, yeah. She's become she's become gain weight, kidney problems, liver problems, all that part. So I would say we still need a medication. I didn't say we have to cut it off. I don't want to be fight against big pharma right now, but definitely not the 6 different pills. I don't know. That doctors probably need some, I don't know, Hawaii trip or something. So he's sell the whole six different prescriptions for this fibromyalgia. Sport, training. For some people, it's aggravate even worse because the muscle is weak, or for some people, it's help a lot. So this is, like I said, all difference. You need to find your remedy. We just can point it out, but how massage can help to tell us where's most of the time of the pain, and I'm gonna talk about this later. So tell me, where's that stiffness? Where's that most pain is coming up?
So there's where it starts and then where I become aware of it. I'm usually not aware of where it's actually beginning. Where I feel it the most is in this occiput here.
Mm-hmm.
And in the what you call the SI joint, the sacrum area.
Sacrum, yes.
The part that helps me to twist and whatever. I feel it there. But I think a lot of times it's probably starting in these muscles and these muscles and the muscles in the thoracic part of the middle of the back. I think that's where it starts, because when I pay attention, I can feel those muscles drawing everything short. And then once it's drawn everything short, that's when this pain kicks in, because it's been pulled on. Does that make any sense?
Yeah. What's the aggravated? Do you feel like smells, like a very strong smells affect you, or light get brighter?
So once the migraine is here,
Yeah.
smells are impossible. Light is impossible. But those aren't the things that bring it on. What usually brings it on is overexertion, stress, overthinking.
Yeah. There we go. You see?
What about your eyes?
Stress.
When you use your eyes a lot, do you think your eyes get tired?
Definitely. Definitely. And I'm on the screen all the time for work.
Yeah.
Well, my daddy was an eye doctor,
Okay.
and there are eye exercises that you'll be able to do to help you out. Plus, I'd like to get you on my horse. And maybe you can go on a horseback ride, and maybe that's part of the remedy.
Hey, it's in Los Angeles. Where do you get the horse? Are you holding horse in your apartment?
No, not in my apartment, but I got horses out in Griffith Park, and you'll be perfect for it.
I love it.
Where do you
Let's
get
do
that
it.
guy? Yeah. So what's the most of the people when come in with this attack by fibromyalgia or migraines or headaches, it's colors too bright. People wants to go inside the dark. They don't want to see any lights, and people wants to go and no smells, aggravated. When people come in massage places, they usually get those aromatherapy, and it's any smells is going to be bad. So try to get those neutralize that oil, which is not have any smells. Any people use this lavender. Actually, this is the worst thing. Trust me. Aromatherapy. The lavender is going to be too tough. All those lemongrass. It's very how I'm going to say, sharp smell, and it's going to be very aggravate your client. So the first thing first, we're gonna do the breath work because people stress exactly, and I'm always teach the people do this breath work. Yes, and you see Regina mentioning all those spots. It's 18 spots, and usually it's spots on the both side, and it's affect your behind the knee, your glutes, couple in the hamstring, the sacrum. It's very effective. The SI joint, which was we've been talking about, the clavicle muscles, clavicle points, pectoralis muscles, neck, and occipital area. This is 18 points. We're gonna put these pictures up here, so learn them and work. And guess what? I want to talk about this pressure. Some people love strong pressure with fibromyalgia. It depends on person, and some people don't. So always ask, how's the pressure? How's the pressure? And that's gonna give you a little bit, better treatment. Also, what I'm learning, it's fascia work. Move the fascia around. Move the fascia around. Regina, I work on Regina 2 years?
5.
No. No way. Yes, but it's help. It's getting better, but still get attack because, like I said, maybe some stress, which is stress. It's help a lot. Help a lot with the to aggravate this fibromyalgia, and the food, your nutrition.
Gluten, maybe
Gluten. Oh, gluten is the worst. Gluten is the worst. I'm like, I can't even do gluten anymore because I'm get upset. My start sugar. But I love sugar. Sugar is my drug, right? It's our drug. It's the drug number one. But sugar is give you that actually foggy mind and aggravate all those. Guess what? When you sugar come inside your body, your fascia is start getting more dehydrated. So you need to hydrate your fascia. And I'm just put this another picture right here. You can see the dehydrated fascia and hydrated fascia. And guess what? When your fascia dehydrated, it's create a lot of problem in your body because fascia connect to your brain. You want to?
That's right. I want to tell you something too. Is that in your entire bloodstream, there should be 1 teaspoon of sugar. Your entire bloodstream, that is a normal amount of sugar in a human being. Now, 1 teaspoon for your whole body.
Now think about you drink, 1 can of Coke or Pepsi. It's like what, 8 spoon of sugar. It's a 25 grams. So just think about it. And you drink like 5 of them or 6 of them, and you get another sugar. So it's a lot of sugar in your body. All right, sugar baby.
Now you want to work on this woman.
Yeah, we're gonna work on Regina. And first of all, we're not gonna do undress her. We'll just explain what we're doing. And we're gonna start with the sacrum and the knee. So go ahead, take your scarf.
And then face down?
Yeah, we're gonna go face down.
Thank you so much for everything. This is all that I have, but this is for you.
Oh, wonderful, wonderful. That
All
is
right.
incredible.
Give it to me. Kids don't need the money. Yeah, let's work. Let's work first.
Damn.
Yeah. Regina is on the table. She usually don't like that bolster, but I usually put the bolster, not put the pressure on that ankle, but she loved feel that stretchy ankle. So what I'm doing here, if the attack is like right now, it's a pick of the time, like I said, I'm starting with the breath work. I place my hands on that thoracic area, sacrum, just breathe, and I'm start slowly. I do a little bit shake her up. I want to relax. I can feel how stiff she is. She's not that bad right now because she don't have any migraine, but when it's happened, it's usually different. Like I said, observe. And if person undress, it's also great because you can start move that fascia, which is I can move that fascia and just see which way is the fascia moving. Where is that stuck fascia? Breathe. You can stay on the top of the table doing this breath work. Just attach a little bit. Don't push too hard. No need to. Take a big inhale. When she's inhale, you let it go. And when she's exhale, a little bit help. Apply 2-3 pounds pressure with her. Just like that. I love to decompress that lower back and that sacrum. I come up right on that sacrum, hold that sacrum, and when she's breathing, I'm just, pushing down. I can move around. 2-3 minutes. 2-3 minutes. You work, you move your person around. The next one is going to be that SI joint. So I come up here. My palm is pointing towards me, and I'm start doing movements. Whatever you like, if you feel this table is great. I mean the level. So working on that hamstring. Next one, I found the SI joint, bring this knee up, and I start pointing towards me, away, and here we go. Sometimes it's click. So I'm moving around. I'm not pushing too hard. How's it feel?
It's tight, but it feels like relief.
Good. So I can push up here, ask it to resist me a little bit, push against me. Very light. I say people don't push too hard. So this is the sacrum. You can also do some very gently. I place 2 hands on the top like this, and I start doing kind of pushing down and rotate in all different directions. Sometimes you feel the click. If it's painful, people always let you know. Don't push too hard. Next one is, like I said, it's a lot of points that the glutes is very sensitive. I usually not do deep work. I start do those knuckles. We've done this many times. All I do, little twist. So pushing down and twist. What I'm doing here, I'm reactivate this muscle. I'm making a little bit waking up. And some people I see use the cupping. I don't think you want to use the cupping on fibromyalgia or headache. Well, you guys leave your comments below if you're a therapist, if you experience that. If you have a client who experienced fibromyalgia and you did cupping and it's work, just let us know so we can try it too. But I believe the cupping, that suction, it's create more kind of fear for clients. We never done cupping on you, right?
You haven't, but I have had it done.
Yeah, so, but it wasn't fibromyalgia back there. I mean, that attack. Here we go. And like I said, Regina is doing pretty good, right?
Today's a pretty good day.
Today's a pretty good day, so, and the massage, it's help.
It's a lifesaver.
Exactly, she feel right away, she's like 50, if even you drop 20-30% of this suffering pain, this is already great. Next one, hamstring. I usually, yes, very gently. I don't try. Same thing. I'm just moving hamstring around. Sometimes, they kind of stick together. They're a very sensitive area, even not for fibromyalgia. So I just move this around. And like I said, I have persons who's been doing treated fibromyalgia, and they experience fibromyalgia maybe twice a year. So this is how good. Like I said, it's ice bath. She's using it, and for most reason, I don't know what. I've never met any guy with fibromyalgia. No, it's only a woman. So it's have to be something on emotional level too. So we need to pay attention to this. Yeah, the man is make you suffer with fibromyalgia. Oh, those men, bastards. So this is what I'm doing here. Next one, I love to work on that point behind the knee. It's always sensitive. I usually come up here, place that foot on my chest, or if you're a woman, put the pillow, and I got right in here, 2 fingers. I don't know if this camera can look. So, yeah, I place on lateral and medial aspect of the knee, and I'm just moving. You see, I'm moving in and down. How's it feel?
That feels like true relief.
Exactly. You see, this point is very sensitive for people. So be gently. If you don't like this one, okay, grab that foot, place on the top, tuning fork like this, place it, and move up and down. This is another one, very simple, very easy. I like to move myself because Sometimes it's when it's pointing me in the chest, I kind of feel a little bit stretchy for myself too. So I kind of treat my body to, here we go, move. So remember, we got 18 points. 18 points. It's also lower back. SI joint here, couple spots in the glutes, behind the knee, and occipital area, and going to be in the front. So David is going to be work on the clavicle area, occipital.
Don't forget levator scapular rhomboids.
Yeah, elevator scapular rhomboids. You see, we already know that.
That's a big point for me.
Sternocleidomastoid muscle is going to be effective too, so work on those trigger points. This is going to be great. And I know the fibromyalgia people usually want a 90 minutes massage or 2 hours. And I would say it's shorter session, but more often. It's better. Then you just put so much stuff and so much technique in one day, because you wanted this like light work, pressure points. So yeah, let's go back to the lower back again. Lower back, I usually do the lumbar roll. I roll forward, backward. Like I said, you see, do I work on the points? Yeah, I can hold those around that laminum groove just to see when there's tension. And it's actually very tight on the right side. Do you feel that?
Yeah.
Always palpate your clients and see what's going on, see what they feel. So when I'm work up here, I do feel it. So basically here, that massage, it's just the pressure points. It's just the work pressure points. Very gently, make them breathe. You see, she's forgot to breathe. I ask her to breathe again. That breath is going to be relax her. And that's what the point is. And I know it's a lot of people up there who needs help. So we can help you in clinic. We in Glendale. We can also go to your house if you can drive, if you can travel. If it's too much, you can order us online, and our specialists can come to your home and work on you. And you don't need to be in Beverly Hills. We serve everyone. Occipital area. Let me move that table because it's close. So I'm just going to grab you. Don't get scared. Here we go. Yeah. So occipital area. I usually work when people face up, but in this position, I can also work. I can work on that skull. I can work on that traps.
Are you going to do the traction that I love?
Yes, we're going to do traction. You see? Yeah, Regina already tell me what she love, and we're going to show it to you. So here, let me take this blink away. So here, I've just placed my hands, and I ask you to breathe. Exactly. You see, when she's breathe out, I'm... and she's relaxing more. So it's more mix of relaxation massage and that treatment. If you're a sport person, please don't do sport on fibromyalgia, people. Yeah, so the points I can work on that the elevator scapula, upper traps. But like I said, my favorite one, when person flip up, this is David is going to do. What else I do, it's people very love. Like, you know, when the little kitty, when the mama cat lift him up, she grabbed that neck area and she pulled. So she kind of bite that area and she lifted. And it's actually very cool stuff. Someone did on me, and I love it, so now I do for everyone. So I'm experiencing myself, everything I'm doing. So I get my fingers crossed together like this, and I'm come up on this area, and you see I'm scooping up, and they relax. And you see it's great. So I lift it up, kind of squeeze, and move it around. Pull up, squeeze, and move it around. And you can do this synchronized with the client breath. So when she's like breathe in, you pull. When she's breathe out, you... It's all about breath work, too. Because client more relaxing, stress. Remember the stress, that's the first guy who ordered those migraines and fibromyalgia, stress. Okay, here you can also work on that occipital area. I do not do the midline, so you find that occipital, you go on the side, and you gently can work here. See, I'm sitting. I can push, I can breathe, I can just hold it without put too much pressure. Always communicate. How's the pressure?
Oh, it's good.
Good. If sometimes people are not going to tell you the pressure is too much because it's very sensitive. Even light pressure with 2-3 pounds can be effective and too much. Next one, look at this. The skull is open, all this area. And this fascia around head is stuck a lot.
Yep.
And you want to move that. You want to move. You see, you kind of squeeze, you work on that. You can go a little bit fast. And this is great. Skull massage is always great. All those guys who work in the office every day for 10 hours, you guys order those head massage in your office. You need those head massage.
And pushing on those plates helps me when I have a migraine.
There we go. You see? When I push it, it helps. So, why we just do this? Okay. All right. So now this is the face up. I mean face down. Now David can do face up and work on those sternocleidomastoid, occipital, and clavicle. I mean occipital, clavicle, and neck. You ready?
Mm-hmm.
All right. Yeah. Let's go flip. Slowly. Now, David, you're going to break my spyglass.
No, I wouldn't.
No, you're not? Okay.
And slide down just a little bit more.
Yeah.
Let's see, I need a couple of puffs.
You gotta
What's in that thing?
And the hip
Tobacco.
flexors. Hip flexors. I forgot to say hip flexors. That hip area is also very effective. Here, what I'm doing, I'm not going to release that hip flexors right now. I'm not going to work on PSOS. Gently, what I'm doing here, I'm doing clockwise movements when my client is breathing through that belly. And of course, it's going to be no lights. Trust me, if the lights is going to be very bright in the room, you're going to be very effective. And I can work on that area like a little bit. Just breathe. When she's inhale, I'm hold it. When she's exhale, I'm just follow and get in this area. So this is important. Watch our video, work PSOS, iliacus muscle, how we do this, and not in fibromyalgia case, but David is going to continue.
Now, you don't mind a towel underneath your head, do you?
No, I don't.
So tell him, what are you doing now?
All right, so now I've got to loosen up. Her muscles of her back are falling down away from her nerves, so I can loosen it better. So I can feel where you're tight. All right, so I'm just going to loosen up, do a few things here. You can't see too much, can you?
No, I can't see through the Regina, but just if you tell us what you're doing,
Oh.
how great is this? Does that feel good,
Oh,
Regina?
it feels like such relief.
Yes.
Yeah, because it's because all this pressure here.
That shoulder blade area always feels jammed,
Mm-hmm.
and it feels like he's untangling it.
Yeah, because I learned how to I can tie knots and untie knots. I learned that in the Boy Scouts. So here you can figure out what's good, what to loosen in here, and all of this. Boy, it is a little bit on the tighter side.
And today's a good day.
Now let's see. So there are things to do this way. Now you're saying up in your pec in here, it gets tight here.
Everything attaches to the clavicle.
Yeah, it's like pet packs. And
from the pec and from the neck, where it attaches bottom of the clavicle, top of the clavicle, agony on a regular basis.
We're gonna put these points one more time right here, guys. So just remember, and if you're the person who's experienced that fibromyalgia, just remember them too. And I forgot to turn my microphone on, so I'm gonna speak this again.
I could put her on her side too.
So yeah, we're gonna put those points again, and just memorize them. And when you go to a massage place, just see if the person work on those spots. If you're not, just ask him, like, do you know those 18 fibromyalgia spots? And if person say yes, you'll know what he's doing. If not, just don't waste your money, don't waste your time with this place. You need to go get to professional to help you out. You don't want to suffer for days. And guess what? When you suffer, you can't do anything basically. You can't work. You can do nothing. So that's what we're looking for. So David, yes, working from hands down under the table, and
now if you want me to do that, I can put you on your side. How about that?
Sure. You want me to face that way?
That's better, right?
yeah, but it's what you're going to do. Well, let's
No,
let's
face
work.
that way.
Yeah, let's work.
Yes.
Yeah, let's work on the sternocleidomastoid. Show the sternocleidomastoid, and we should
I
be.
worked on her. So with headache people, I don't pull on it, but I do work on it. I worked on it different ways. So I can feel both. I can do both at the same time. Here. I'm super careful on these kind of cases here.
We all do. Remember that rule. Don't try to help person right away. Like you have
feel
to
tight here, right?
very slowly, because if you overdo, the person is going to be like in more worse situation. Here we go.
Right there. When I'm in a full flare-up and a full migraine, that spot where you are right now, it feels like someone has a vice grip on it 24/7.
Right, because the nerves are right in here.
Yeah, and it's also first strip. The first strip can be decompressed on that brachial plexus nerve.
Right there. And it can be 36 hours of agony in that one spot, as if somebody's pinching it and won't turn it loose.
It's 36 hours. And I know people do more than that. So you can be suffer for 36 hours.
It's brutal.
That's pretty bad here.
And it creates a lot of vomiting.
Oh. Well,
When I'm in that kind of a flare-up, the pain is so intense, it brings on a lot of vomiting. The fascia release work that Jay does when I'm in a flare-up always stops the vomiting. So there is a connection between...
Fascia always, yes, guys. Treat the fascia. I was watching this new research, and the fascia, it's just, this is what we're looking for. The fascia more in pain than everything. The fascia is connected. This is your net around your muscle support and cover your muscle, and that's what create that pain. So fascia work is important and very, very help.
And the vagus nerve is in the area you're also
Yeah.
treating, so I'm sure it's a combination of the relief to the vagus nerve, allowing it to resettle, as well as what you're doing with the fascia.
You see how educated our client? Yes, we educate them. We're not just give them the treatment. They know what's going on. That's the main idea. All right.
all right, good. So I could...
Let me, you can record me, so
Okay.
just look at this one. Yes, so we already did, I'm going to show what especially Regina like, because I say we can use all this. You need to push the button.
This one here?
Yeah, no, this one, red.
Oh, this one.
Okay, so she truly liked that decompression,
Oh yeah, the traction.
traction, decompression of the spine. So how I do it, I place my two hands like this on the top. My right one is dominate I'm holding it, left one is supported, and when I'm just leaned back. You see, I'm leaning. I'm not doing my arms like people will see. You're gonna injure your shoulder too. So I'm lean back. If I'm standing, I can stand up and lean too. But I'm gentle, and I just pull, hold, and release. Pull, hold, and release. Also, Regina liked it. She liked that. I call that ring, like that ring, like that. When the diamond holding in those whatever how they call
setting for the diamond.
Yeah, setting for the diamond. So this is the diamond. This is my setting for the diamond. I'm up, come up here, get my elbow, and here we go. You see, it's diamond. Diamond, the head inside that. I'm not cover the ear. Some people get cover the ear. It's create that vacuum and push too much. You see, my finger is open. The ear is right there. And what I'm doing, I can do talk to chin. I can move around. You see, I'm pulling. She's completely, my elbow's on the floor. You can hold a bigger head. You can do side bending. She like do the side cross arms. You see the cross arm, and you can bend to one side. She loved that stuff. She liked that pulling. Here we go. You feel that click? Wow, it's just amazing. You just click it, and then pull this way. She's breathing. She relax. I do not side bend that neck. You see, the head is turning. So I turn the head. I'm not do side bending. I don't want to put too much pressure on that cervical. I'm going to show you one more time how I do it. So you see, you lean and the head is kind of following and rotated. It's not tilted. And now I'm pushed that, kind of create that push and stretch. It's pulling. Switch. Same thing, you see. I can do standing. I can do sitting. You can do more. She loved more. She liked resistance. Push back against me. And let it go. And of course, I finished my session, another decompression of the spine. And David, he don't like to squeeze sternocleidomastoid. I love to squeeze sternocleidomastoid. It's like
on migraine people.
On migraine, yeah. No matter. You bend to the side you're working on. So the sternocleidomastoid pops up, and I'm just gently pull up. And you can see I don't use any oil at all. So I want to feel that fascia.
For me, that's a must on a migraine. But I also understand from talking to so many migraine patients.
Exactly.
Not two migraines are created equally. So what works for one person, I love this.
Yeah.
Might be a death sentence for your person.
Yeah, like I said, it's like you always you build this.
Not really a death sentence, but
Yeah, no. It's you're right. Like I said, for some person go to the ice bath is going to be released that migraine. For someone, it's going to be the killing.
Oh, for me, it would kill me.
Yeah,
I need heat.
Heat. Yeah, some people love heat. We're all different because you know who's involved in everything. Who? Can you guys tell me who involved in everything?
Santa?
No.
This guy right here. Right in here. Mind. The mind is creating everything. Create the studio, create me, create David. Everything is created by mind. And mind can create those pain and discomfort. For trauma and stress. This is all common stress. I can tell you 100 stories. I went to this meditation center for 10 days. You have to sit down and meditate 6 hours. My brain create that lower back pain, that suffering in my spine and everything. So he pushed me out. He said, you have to get out of here. And day 7, I move out. I step outside. Since I just step outside, my pain is gone. He's like, here we go, I won. So my mind is tricked me. So you always trick us. But it's just deep. It's not our scope of practice. What massage therapists can do, working on those 18 points, give you nice calm massage, working on this area, get you breath work, and you're going to feel better. This is what we can do for you. So give us a call if you need help. We here in Los Angeles, we can go to your house or come to our clinic. Thank you. That's it. You want to work a little bit of work more. We can turn off.
Okay.
Just work on her.
Yeah. I do it. So side laying stuff there is to do.
Decompress of first rib. Oh yeah, let's record the decompression of first rib. You can come up from here, and you want to do sitting too.
I could have her lie on her side. I can do
Face that
things.
way?
No,
Yes,
no, no.
but first we're going to do.
This one, just hold it right here. So just open this up so you can see it. I'm already recording.
Okay.
So what I'm doing here, decompression of the first rib. Sometimes I do sitting for people with the fibromyalgia. So you're going to find that trapezius right in here. You do not point in this triangle between the clavicle. I know it's a space and you can feel that first rib up there. This is the safe way. So find that. It's a levator scapula right there, levator scapula, and you find that trapezius muscle, and you just,
Oh, yeah, that's it.
and you feel that first rib right there, and all you do, Klein, you're breathing deep. There we go, and she's pushing against it, and when she's relaxed, you apply a little pressure. Gentle work, don't need to push too much, and she's breathing. Sometimes people say, "Oh, I feel tingling, numbness in my hands." Yes, they can experience that. Be very gentle, push it out. For the bigger guys, yeah, I do sitting position and I do decompression like very good and strong. So they just like, oh man, this is like feel great. But this is very gently, she relax. Remember, when we stress, what we're doing, we shrug our shoulders first, and that rib is pushing against that nerves up here, which is brachial plexus nerve, and create that numbness, discomfort in your hands. So you already know that's what's going on here. So here we go. And this is what you do for at least like 4 or 5 minutes. She's breathing, she's more relaxed, and that's the key. Okay.
Sit up or you?
Yeah, we
sit
set up. We're gonna edit. No, from the side. So this is we're gonna teach the client how to get up. So you see, no, don't worry, we're gonna chop it off. So teach your client how to get up from the table, because especially with the lower back, it's gonna be a disaster. If a person's gonna leap forward, gonna damage again. So here, the client is going to drop that knee on the side and roll himself on the
Gonna
side.
push me into the floor?
No, I'm not. You're not going to falling off. Watch. No, you see? No, she's scared. No. Here we go. Now she dropped the knee and pushed his arm up. And
I see.
this is how you teach your client to get up. And this always work. Yeah, I know.
You're gonna dump me in the floor.
No, I'm not. Never happened. All right, Regina. So don't worry. We'll get to catch him. How do you feel? You feel
I
better?
feel so much better. Please catch them.
We will catch them. But guess what? They always sneaking out, because those guys is very coming, and they almost everywhere. So feel better?
I feel so much better.
Guys, remember 18 points of pressure, and if you see those guys around your house, if you feel they're around you, give us a call. We try to catch them, help you out, at least protect you, and make you feel better, right?
Thank you.
You're welcome, yeah.
And she doesn't have enough tattoos. I've noticed that.
I know. I need more tattoos.
Yeah, was
Maybe
it?
like this.
No, don't do it. This is nothing to do. It's just again, mind. The mind is creating this. He want to create some different character. But yes, so migraine, headache, they can be separate. They can come together, which is the toughest case when a migraine, headache, and fibromyalgia hit at the same time. Trust me, yeah, you're gonna be. It's not that good. It's not that good. So let's stay away from this as far as possible and treat yourself. And find your alternative remedy too. Herbs, acupuncture, exercise, swimming, exercising, massage. We're just another tool who can help you. So find your tool and treat it.
Ditto.
Okay. Howdy. You guys have a wonderful day. Bye-bye.